Hi, Dr. Shauna Rupel, Girl Next Door OBGYN. So I'm doing some reading this weekend and I thought I would chat a little bit about aspirin use in pregnancy. So you may have noticed if you've had a pregnancy in the last 10 years that we talk to you about aspirin usually at your first visit. There are many indications for starting aspirin in pregnancy. And the reason that we think that this is helpful is because it's anti-inflammatory process. It actually inhibits and decreases some of the prostaglandins and changes some of the vascular interactions that happens between mom's uterus and the placenta when it's forming. And we think that this results in decreased risk of preeclampsia development, growth restriction, hypertension in pregnancy. So you may have been, or it may have been recommended to you to go ahead and start aspirin, usually baby aspirin in pregnancy. Generally, we're going to start that around 12 weeks and you can continue it until you deliver. You don't need to stop it when you go into labor. It's not a high enough dose that it's going to increase your risk of having a hemorrhage or having bleeding complications with your pregnancy. But many different reasons why we might recommend it. So one of them is that if you've had a prior history of preeclampsia, if you have had a growth restricted baby, if you have a personal history of hypertension, if you have pre-existing diabetes, if you have multiple risk factors, so more than one risk factors, including advanced age at delivery, so greater than 35, elevated BMI when you become pregnant, a first degree relative with preeclampsia, which is going to affect a lot of patients, African American race, or a previous adverse pregnancy outcome, lower socioeconomic status, and more than 10 years since your last pregnancy. So it's interesting, there's lots of different reasons that we might put you on aspirin. I sometimes will joke around with my patients that I feel like aspirin might be useful to have included in most prenatal vitamins, but this is just a little bit of background about why aspirin could be recommended for you. If you want more information, reach out to your OBGYN or comment on the video. Bye guys.